was a pivotal moment when the country went into lockdown and the parking lots cleared and everybody went home, when I knew that there was some kind of a need to have a symbol to draw people together during the pandemic, much like you see ribbons during like local community tragedies. So that's how it started. How can we develop a symbol? And then from there, it was, how can we potentially sell something and send the proceeds to COVID-19 healthcare workers and research efforts? I think it was a calling initially. It was, how can I do my part to help out and give back during one of the greatest tragedies of our time? And then shortly after we started, my cousin passed away from COVID. It was like February of 2021. And it just kind of reaffirmed what we were doing and the importance of what we were doing in giving back and helping those that were helping people with COVID-19 during the pandemic. The success of this project depends on the volunteers. There's nobody on salary here. And I think the people that are with us, they understand the value in giving back to the community, and it's kind of a win-win for everybody. And just at the end of the day, having that good conscience that we did our part during this great healthcare travesty.
For me, it's getting really involved in the community, and especially healthcare workers, if you will. They are working so hard to help all of us. Why not help them as well?
I tell people all the time, we've donated over $15,000, but I really care about what that money went towards. It was everything from people going home from the hospital that were increased risk. They went home with COVID-19 kits. There were 800 of them. Money went towards frontline healthcare worker resiliency efforts. For example, catered meals, snacks, things like that. And then finally, medical equipment. So like the University of Maryland School of Medicine was able to purchase one of those freezers that houses the virus and the samples and things like that. So the impact is what we're really proud of.
Healthcare workers, we always think they're all doing so well and all, but there are so many healthcare workers that really are struggling day to day. And I thought it was about time to give back and help those who are helping others. And those are the doers of good. And figured this was a good way to give back.
We have 3 core values, and the motto is hope, fight, unity. So hope, during the darkest days of the pandemic, hope was hard to find, so there's always room for hope. Fight, we're fighting for low-income healthcare workers right now and those communities that still don't have good COVID-19 information. And then unity, obviously, we're all in this together. So the motto is hope, fight, unity.